Hi, I'm Dr. Ken Erickson, developer of the proMAKER method and creator of the Step Up to Ultimate Performance. A lot of people ask, what's proMAKER? Well, proMAKER is actually an acronym. It's an acronym that kind of breaks down a lot of how you identify what's wrong in an athlete so that you can actually fix it and move on and make some tremendous athletic performance gains. So that's what the proMAKER is. And it basically breaks down like this. PRO, performance reductions occur. When do they occur? They occur when microscopic adhesions kill efficiency, range of motion, respiration, and recovery. So let's break those down just very briefly. We can go into more detail in other videos, but let's get a real brief overview right now. What's a microscopic adhesion? Microscopic adhesion is kind of a fancy term for scar tissue. When you exercise on a regular basis, you're training a great deal, you're breaking down tissue with the hopes of building it up stronger. How does your body do that? It breaks it down, it becomes inflamed. Inflammation is almost like liquid scar tissue. When that liquid actually dries out, it turns into solid scar tissue. It leaves bits of that throughout our body. And depending on the type of training we do, we're more prone to building up certain types of scar tissue, certain types of microscopic adhesions. And those microscopic adhesions can be found in in any of the tissues of the body, just about, muscles, ligaments, tendons, within the joints, around nerves, all of those. So that's we want to make sure we clear away all those different areas, not just focus on one or two tissues. Make sure every single part of your athletic body is working the way it's supposed to. So if you have those microscopic adhesions, they can kill efficiency, right? Well, efficiency means the joint's not moving properly. It's not moving through with the right effectiveness. It's supposed to have a very coordinated movement, and if it's not, it's becoming inefficient. It's maybe imbalanced. It can also happen to the muscle, where you can have an inefficiency to the muscle. And there's also an aspect where it can affect the nerves as well. If the nerves aren't firing back and forth in quite the way you're supposed to have them, then you have an inefficient communication between brain and body. Next up, we have range of motion. If it starts with an inefficiency, it oftentimes then goes into a range of motion where you now have a limited range of movement, whether it's the joint, the muscle, and believe it or not, actually the nerve. The nerve needs to move through the soft tissues as well. If it's not moving properly and smoothly, it's actually going to become impinged, and that's not good. We call that a peripheral entrapment of a nerve, and you definitely don't want that. So the movement of the muscle is very important, muscle or the joint or the nerve. Now imagine if you're a runner and you don't have full range of motion of your hip or full range of motion of your hamstring, or your sciatic nerve is getting kind of caught around one of the bony prominences because it doesn't have the full range of movement itself. Then you try to take that full stride, you can't do it because it's being caught and you're being limited. So you want to make sure you have full range of movement of all parts of the body and all tissues of the body. Next up then we have is respiration. Range of motion kind of builds into respiration because respiration is all about getting oxygen and nutrients to the tissues. Now, some of the tissues get oxygen pretty easily, like muscles actually have a direct blood supply. They can get more oxygen and nutrients by movement, which actually increases the respiration, but some tissues don't have a blood supply at all, like joints. Cartilage in the joints does not have a direct blood supply at all. The only way it can get oxygen and nutrients for healing or getting stronger or whatever is going to come from body movement. And full range of motion, on a regular ongoing basis is the best way to get that in there. So range of motion ties very closely to respiration for a lot of things. Then after that, you actually have recovery. And you can imagine if we've now gone through efficiency, which tends to lead to range of motion losses, which tends to lead to a reduction in respiration. Well, when all of those things occur together, you'll actually get what's called a lack of recovery. Your body, when you damage the tissue, whether it's healthy damage like from training or whether it's sports injury damage, not so healthy, you'll find that your body has to recover from that. And if it doesn't have all of these factors working together the way they're supposed to, all the proMAKER factors working properly, then you're going to have a slower recovery. And that means you're going to accumulate more and more damage with each training, and you're going to accumulate probably more microscopic adhesions as well, which is just going to work completely against all the efforts you're trying to do to improve yourself as an athlete with all your training. So that's the proMAKER. Let's review it real quick. The proMAKER method is performance reductions occur when microscopic adhesions kill efficiency, range of motion, respiration, and recovery. So when you identify those things, we need to know how to fix them. I'm going to go into much greater depth about each of the different aspects of proMAKER in some future videos. And on top of that, we're going to start, after we have a pretty good idea about that, we're going to start talking about the step-up method, which is how you fix those things. So keep posted, and I'll see you on the other side.